Regarding orthodontics, people think about braces over the tooth, wires and clips. And right now, current scenario is like people are like thinking about aligners, invisible braces. Those things are coming up right now. Orthodontics is nothing but not only alignment of the tooth. By aligning, like we can bring the upper and lower teeth in contact in right position so they can use the tooth properly for chewing and mastication the foods, and it is also improves their speech level based on their habits. Cosmetic correction is not the right way to use for orthodontics. Okay. So people nowadays, especially teenagers, what they feel like having a wire, braces, metal things inside the mouth, that is like a little painful. Okay, and they don't want to take up the pain, and they aesthetically their appearance should be enhanced. So that's why they are not preferring braces. They are coming into aligners. We cannot provide aligners to all the patients. Okay. There are certain criteria. So for which patient we have to go for aligners and for which patient we have to go for braces.
Welcome back to Health Unplugged, our superstars. Today's episode is something that has quietly and completely transformed over the last decade, orthodontics treatment. For many of us, orthodontic treatments brings back memories of, food getting stuck or painful treatment, metal braces, or even a long-term treatment care. Today, it's more about personalization, customization, shorter treatment period, and moreover, comfort of a patient comes first. So, how does someone decide whether to go for braces, aligners, or just the dental treatment? And how does the plan work for an individual patient? And specifically, how does the plan work for you as a viewer? So, to cover all these aspects and to know more in detail about orthodontics, we are joined by Dr. Balajee, who is an orthodontist with more than 10 years of experience and a founder and head of Elite Dentistry. Welcome to our podcast, sir.
Thank you, ma'am.
We are delighted to have you on the podcast.
Same too.
So let's get started onto the topic. In today's time, when it is about orthodontics, what actually people think and how they turn up to the treatment?
Regarding orthodontics, people first comes to know about, think about braces over the tooth, wires and clips. And right now, current scenario is like for thinking about orthodontics, like people are like thinking about aligners,
right?
Okay, invisible braces. Those things are coming up right now. So as the modern age, like upgradation is happening in all the fields. Okay, even in orthodontics, that's happening too.
Let's find out what actually is orthodontics. So, sir, what actually is orthodontics?
Orthodontics is nothing but the thing is like aligning the alignment of the tooth.
Okay.
Okay, not only alignment of the tooth. Okay, by aligning, like we can bring the upper and lower teeth in contact in right position.
Okay.
So they can use the tooth for properly for chewing and mastication the foods.
Okay.
Okay, and it is also improves their speech level based on their habits and the alignment, tooth alignments.
Okay. Let's try to find out whether orthodontics is just about aesthetic solution or it's more than that. So, sir, when we are talking about this topic, it is actually felt that it's just a cosmetic correction to get better smile. What or orthodontics?
No, it is not in a right way. So the thing is like cosmetic correction is not the right way to use for orthodontics.
Okay.
Generally, orthodontics is based on functional way, okay, functional method, and it is like teeth alignment. Why it is so important? Because if teeth is crooked or kind of like mismatching upper and lower teeth contact, okay, there will be a lot of food accumulations and they cannot chew properly. Functionally, that will get affected. Okay, so to improve that functional, to improve that teeth alignment because of the functional improvement, okay, so that they can chew properly and they can eat. So okay, there's a main reason. So why we are doing orthodontics, and it is like totally different from cosmetic. It is also into it, but major role is like to correct the teeth for functional usage.
You could say, is it more of a preventive type of treatment?
Preventive is like if you start in the early stage.
Yeah.
Okay, so in later stage, like we have to correct the teeth alignment only because of like aesthetic wise appearance. Point number one, and point number two is like for functional weightage.
Got it. So, sir, at what stage the misalignment starts impacting the overall health of a patient?
Stage wise, like if you see that, like we cannot predict at what stage it happens. Even it happens in the early stage also. Okay, with the tooth erupts, or maybe because of any kind of impact in teeth eruption. Okay, maybe after 18 years, even the wisdom tooth can cause any tooth misalignment and all. So those issues, like we cannot judge the stage. Okay. But alignment wise, if there is any crowding or like improper position of the tooth, that leads to discomfort and leads to a lot of issues.
Okay. So let's try to find out the patient side of a story, sir. What are the most common reasons that a patient walks into your clinic with?
So regarding orthodontics, patients will come in with saying that like they feel like the tooth is little out, okay, and it is not aligned properly. The tooth is like here and there, and they couldn't smile properly. Okay, that is what the main issues.
Okay.
And one more thing, very few people say that they cannot eat properly. They have some pain in their jaws, so because of chewing and all. So these all things mainly because of misalignment of the tooth.
So it's like more of a functional, more of a structural issues.
No, exactly. The thing is like related to functional thing. Okay, but the thing is like without examining the patient, okay, we cannot come into a conclusion what is the main reason behind it. So after examination, like what has to be done, everything, treatment plan can be derived after the examination of the patient.
In earlier generations, sir, there was a lot of discomfort when people used to think about orthodontics treatment. So in current era, are the adults more open to orthodontics treatment? Are they more comfortable with technology?
No, the thing is like in 2000, from 2000s, if you see that there's the start of aligners coming up into the market.
Absolutely.
Okay, so braces is generally it's there from quite a long period. So people nowadays, what they, especially teenagers, what they feel like, it is like having a wire braces, metal things inside the mouth.
Yeah,
that is like a little painful. Okay, and they don't want to take up the pain, and they aesthetically their appearance should be enhanced. So that's why they are not preferring braces. Okay, they are coming into aligners. So as the modern age comes up, as the advantage, technology grows up. Okay, this aligners is coming into the market. Okay. So it is like it is also coming up more. They are coming up with a lot of ideas, and they are developing it, and they are multiplying it. Like there are so many aligner companies over there.
Yeah.
Okay, so each and every year they are coming up with new ideas, and they are enhancing the power of aligners day by day.
So it's like the modern technology is using a lot of marketing to market the aligners.
So without marketing, there's nothing in this world right now. Regarding the scenario. So marketing based, like the aligners, like the people will think like it is little painless, and it is like they have like they aesthetically they look good. It won't look like as if they are wearing something. Right. So that is what the people, especially teenagers, think about it.
Okay. Since we are talking about the daily routine and braces, how they play important role, what we want to know is in normal day routine, people usually try to ignore if the misalignment doesn't cause them any pain. So is that the case?
So generally speaking, like before, like people don't used to have like the awareness of teeth alignment, those things. So based on that, like they will neglect like wearing they have to align the tooth, and those things they don't give importance to that. Okay, but nowadays, because of like awareness like regarding the tooth alignment, those things, some few programs are going on, especially in YouTube and all. So people like especially youngsters, even like people who are like at the age of 30, 40 and all, going through those things and all, like they want to go for alignment, tooth alignment. So for better functionally and aesthetic way. So to enhance it, they just want to go for it.
So it's a case of more of awareness and more of confidence building in the current age. Let's try to understand the difference between aligners and braces in more detail. So what is the core difference between?
So braces is nothing but like there are two types of braces. One is metal and one is ceramic. Like there's something will stick on the tooth, okay, and we'll be connecting the tooth by the wire. Okay, there will be like some amount of pain will be there. Okay, that is about bearable pain. Regarding like for connecting or space closure or tooth movement and all those things. So when compared to aligners is kind of like invisible. Aesthetic wise, it is more
comfortable
in a favorable. When it is very favorable when aesthetic way. So people used to be like they'll feel comfortable after wearing that, and there'll be little amount of less in pain.
Correct.
Less in pain. When actually speaking, we cannot provide aligners to all the patients.
Okay.
There are certain criteria. So for which patient we have to go for aligners and for which patient we have to go for braces.
Okay.
So those things are there. So we'll discuss in detail.
Okay. Let's go to the deeper science behind the traditional braces. So how does traditional braces biologically move the teeth when they are placed?
Generally speaking, like braces, like the brackets are fixed on the front surface of the tooth.
Correct.
Okay, so applying pressure only over the front surface of the tooth movement will happen.
Okay.
Okay, that's why like some the tooth movement, the duration of the treatment will get prolonged. Okay, it might be like 1 year to 2 years or something.
Okay.
So duration is too much because we are acting in one spot. Okay, when compared to aligners will cap the tooth completely, so it will move your tooth completely towards, I mean, wherever, whichever position it has to move. So the tooth movement, when that in that way it happens, like there'll be little amount of less in pain, and the tooth movement will be precise.
So the
Okay.
technique of alignment is different between
braces and aligners.
Okay. Which are the type of cases where the braces will actually outperform the aligners?
Especially like cases like which patient who has habit, like
Okay.
who used to push their teeth with the tongue,
Mm-hmm.
or they do open their mouth while and breathing.
Mm-hmm.
So in those cases, like braces will act more when compared to aligners.
Okay, so
It's called habit breaking appliance. Like
Okay.
along with that, we'll give the braces. But in aligners, there is a lack of, I mean, to
Covering
avoid
those
the covering
habits.
those habits.
Okay. So, sir, what influences the treatment duration more? Is it the complexity of the case or the method that has been used?
Mainly because of the complexity of the case, the treatment duration differs.
Okay.
Okay, not by the methods. Methods, very rarely that happens. Okay, because generally we used to follow same method for like 80 to 90, 80% of the patient cases. Okay, very few people, like for few cases, we'll alter the method of the treatment.
Okay.
But generally speaking, because of the complexity, the treatment duration prolongs.
Okay.
That to compare with braces and aligners, aligners treatment duration comes down a bit, okay, when compared to braces.
Okay.
Because as I told you before, that braces acts only on the front surface of the tooth, and the aligners will cap the tooth and tooth movement will happen. Because of that, the tooth movement, like there will be like a duration of the tooth movement will be like little faster when compared to the braces.
Correct. So the complexity mainly depends on each patient also, and
Exactly,
Yeah.
it differs from patient to patient.
Correct.
For few patient, like we need to we can, without removing, we can do the treatment without removing of the tooth. Okay, for few patients we need to remove teeth. Okay, based on how much number of tooth we have to remove. We are removing, based on that the treatment complexity differs.
Okay. When it comes to choice given to a patient, even if you have given them a choice of braces, do they come up and say that we want aligners instead of braces? Does that happen?
That happens, yeah, because especially nowadays teenagers, they are not like willing to go for braces.
Okay.
Because of the aesthetic appearance, those things differs. So they want to go with aligners, whatever the case it is.
Okay.
Even though if you say that like aligners doesn't suit you, but they are like they used to say that like, no, we want to go for aligners. So that time we need to modify the treatment plan, everything.
Okay.
So based on that, the treatment duration will get prolonged. Okay. Even with aligners, because we need to stop the habit. So those things will take some time. Okay. So everything depends upon the complexity of the case and patient's willingness.
So next time when you want to decide between braces and aligners, you know the science behind it, and you can consult with the Orthodontics on One Health Assist platform. So what are the factors that you consider while you design a treatment plan customized for each
first
patient?
thing comes around the age.
Okay.
Okay, at what age the patient is walking in. So during like age between the for kids, like around like 12, we'll start the age of 12. Okay, from 12 to 18, like they'll be in a growing phase. So the tooth movement will be faster when compared to adults.
Okay, correct.
Okay, so based on that, we will be planning treatment plan. So for adults, if in case like there'll be some amount of tooth movement will be a little slower because of the bone formation should have finished at the time. So what we will do them, like we won't apply too much of pressure for them. Okay. So we have to gradually move the tooth. So treatment duration might be prolonged sometimes. And one more thing is like their oral hygiene maintenance plays a major role too. That also plays a major role. And one more thing is like their bone strength. Correct. So few patients will come at the age of 30 plus. They ask for tooth alignment. So we have to consider their bone density. Okay, correct. And their bone, oral hygiene. So based on that, we have to do the tooth movement. If in case they are for even patients who have like was diabetic, so we cannot apply too much of pressure because the tooth might get weakened later on.
Right.
So based on that, we will decide the plan. Okay, based on like what is the complexity or like what is the current state of the patient's oral hygiene, oral state. Based on that, we'll decide the treatment.
So, what are the fears or misconceptions uh, that hamper the early stage decision for an adult to start with the orthodontic treatment?
Mainly, see, like people used to say that awareness. First point they used to come up with, like we are not aware of problems, issues
Okay.
in the oral state. Okay, the second one is like they used to give some lame excuses stating that like we had exams sort of finishing my 12th grade, and after that we are just because of the board exams. After that we are planning for braces. And few people like will say they'll come at the age of 30 and they say like we had a lot of commitments. I have to fulfill those commitments, and after that I thought of going for aligning the tooth. Okay, there are a lot of issues like people used to have from different people, might differ people to people. So whatever the status, like whatever the age it is, so based on the oral hygiene, based on their bone strength, everything, so we can decide the treatment plan. So there is no, I mean, I don't see there is a age limit for any patient because I used to treat even the patient at the age of 10. I have a patient who is doing like I'm aligning her tooth at the age of 62. Okay, she's around 60 years old. So we are doing alignment of tooth using aligners. Okay, so we can do it. There is no like age limit based on their like oral hygiene status and bone strength. We can decide that we can do the treatment. Orthodontic
it's more
treatment.
of a priority and oral hygiene that is
Exactly.
even important.
Exactly. That's
what is the ideal age for evaluation for an orthodontics treatment?
So basically speaking, ideal age for like regarding only the teeth, it starts in the age of 8.
8. Okay.
8 years. We can start like where there is a age like where important tooth used to get erupted after that.
Yeah.
8 to 12. Okay, but for few kids, like even at the age of 6, 7 or something like that, there'll be some changes in their bone growth.
Okay.
So for few kids, they used to like their lower jaw might be little longer than the upper jaw. So those corrections has to be started at the age of 7 or 8. So 7 or 8 is the right age to notice like what is the problem with the patient. Okay, so we can come to a conclusion we can derive a treatment plan for a longer duration.
Okay, so do you think that the parents have that kind of awareness with such early age kids?
So nowadays, like if you see that a lot of things are coming up in social media, those things and all. Seeing that, parents bring their kids, one point, and second point is like school in school, the other kids, if they're going for treatment, seeing that they'll come to they want to go to a dentist or orthodontist for getting it corrected. Okay. So that's what happens.
So that's about peer influence.
Influence everything.
Yeah. Since we are talking about the early assessment for kids, let's find out more about that. Why it is important to do early assessment even if the treatment starts in a later stage?
Yeah, that's term called is like preventive orthodontics.
Right.
Okay, so that has to be started. Why we are starting at the age of 8 is like to bring down the severity of the misalignment, those things and all. So we can bring it down. So after like even the treatment, we are planning it after 4 years or something. The severity of the misalignment, the alignment of the tooth, upper and lower jaw contact point, everything will be like it won't be that severe. Okay. So our treatment duration will be slower. Very less. And at the same time, like we can extracting, removing the tooth, those things can be avoided later on.
Okay, so it's more of a preventive plan.
Exactly. That's why it's called like we used to call it as preventive orthodontics.
Since we're talking about kids, so how does habits like mouth breathing, thumb sucking, or screen posture affect the jaw growth?
Generally speaking, that will alter the growth of the bone for patient. Kids who used to suck their thumb. Correct. Thumb sucking habit. Like so, what happens? Generally, when they're holding their thumb like this, the mandible growth of the mandible will get disturbed. Correct. And they're pushing their upper jaw outward. So for those patients, if you can see that there'll be like a kind of a mouth will be little open. So upper and lower, especially in the front teeth, it won't be in contact. Right. So there'll be opening in the front area. So between the upper and lower teeth. And one more thing is like their upper jaw will be little bit ahead of their lower jaw. Yeah. So that will alter the bone growth. So that has to be corrected in the early stage itself. If not, then that will lead to a surgical correction of the treatment. I mean, procedure that has to be done.
Correct.
So those things. And for mouth breathing habit, we cannot say that mouth breathing is best only because of this habit. Okay, mouth habit. I mean, whatever, like external habit. That might be because of the internal habit too, internal problem too. So especially like if they have any ENT issues like tonsils or kind of adenoids or something like that. Okay, so those things will also lead to mouth breathing. So we have to examine. Okay, not only with the dentist, you have to go for a visit with the ENT specialist also to know what is the actual problem behind it because of the mouth breathing.
So this is for all the viewers who are parents to small age kids. You have to look out for these kind of signs and symptoms for early detection of any disabilities in jaw growth. Let's try to cover some myths and facts. So braces are only for kids. Is it a myth or a fact?
It's a myth.
Okay.
So we can put braces for any age group people. Okay, even at the age of 10 till age of 50, 60 also we can go for it.
Okay. The next one is aligners don't work for serious cases.
It will work.
Okay.
It's not like that.
It's a myth or a fact. Orthodontic treatment is extremely painful.
It's a myth. It's not like that.
It's not painful.
It's not that painful. Mild.
Okay. So next one is once the teeth are straightened, they stay in that position for a long, forever. So this is a myth or
it's a fact.
It's a fact.
It will stay. Okay. Might be some exceptions will be there based on their habit they develop after the treatment. Okay, so that will cause some kind of this one, and especially people like kids, we will be providing them retainers after the braces. So if they don't wear it properly, then there will be the tooth will come back to its old position.
Okay. So the next one is excessive chewing of chewing gum will affect the strength of the jaw or the alignment of the braces.
Especially jaw, it won't play any major role. Okay, but the problem will be in the tooth.
Correct.
Okay, excessive chewing, what happens, right? The tooth layer of the ring, your outer enamel layer will get eroded. Okay, on the tooth, and you might lead to sensitivity in the early age.
Correct.
Okay, so excessive chewing, and people used to like chewing only on one side. That might lead to a TMJ issues.
Okay.
That might lead to TMJ issues. So those things will happen.
Since we are talking about orthodontics treatment, let's get to the patient and their commitment to the treatment. How important it is compliance from the patient side that affect the orthodontics treatment?
So it is extremely important, like patient's cooperation.
Okay.
So without like patient's cooperation, we cannot do this treatment, because the thing is like 80% of the treatment will be done by the doctor.
Correct.
And the remaining 20% of the treatment will be done by themselves. Okay, whatever, like kids, anybody, age group, it is like they have to cooperate with the orthodontic dentist, like what they say. They have to listen what all, they have to follow the protocols, what all things orthodontist says.
So it's extremely
important for it.
Okay.
They have to cooperate with the doctor.
So when we are talking about difference between aligner and braces, so do aligners pose more responsibility on patient side when overall treatment rather than the braces?
Exactly, because the thing is like the treatment duration for wearing the aligners, because aligners is the thing like patient, they can remove it by themselves while eating and they have to wear it back.
Okay.
So per day usage of the braces aligners should be around 22 hours.
22, okay.
Exactly. So only for 2 hours they can remove it for eating. For few kids, like few patients, like they will remove it for 4 hours. It's okay for 20 hours. So if you are removing it for 20 hours, the treatment duration wearing one aligner, it will get prolonged little bit.
Okay.
Okay. So there will be duration for each and every aligner. So per like 10 days to 14 days. So based on that, like how many hours you wear it, based on the duration of wearing aligners, it will get prolonged, extended. And one more thing is like we have to keep it safe. Okay. If we lose it, the treatment will get interrupted in between. So without losing, because especially kids, they might lose it, they might break it. So reapplying for that one number of aligners will be a little expensive.
Okay, so then it even hampers the.
It will like the treatment duration will get prolonged. The tooth might move to its back to its old position. Those things happens.
Let's talk about the oral hygiene. So, sir, does the oral hygiene change when a patient starts with orthodontics treatment?
Especially there will be mild change will be there. That's why we used to keep on working like patients, like keep your oral hygiene. They maintain your oral hygiene. Brush twice daily. Okay, you have to goggle after every meal.
Okay.
Those things and all, we used to keep on telling that because during orthodontic treatment, the tooth movement will happen. So the gums around the tooth will get little bit swollen, will get inflamed.
Right.
Okay, the food accumulations might be there. So that's why we used to keep on telling patients like brush twice, brush properly, use mouthwashes, goggle after every meal, so that like we will can prevent like from food accumulation.
Correct.
Over the braces and over the gums.
Since we're talking about oral hygiene, let's talk about the diet changes. So, what are the dietary changes that affect the brackets or aligners or braces?
So for generally, if you see that, like for brackets, you cannot have anything hard.
Right.
Like especially hard items like chicken bones or mutton bones, and the cheesy items to better to avoid, like pizza,
get stuck
burgers.
on the-
Yes, that'll go get chocolates.
Yeah.
Those things has to be avoided. Okay, so especially if you see that, like junk foods, stop your junk foods.
Okay.
Okay, that's what we used to say. So aligners is totally different because wearing aligners, they cannot eat properly. They won't eat. We don't ask them to eat food wearing aligners.
Okay.
Okay, there's one thing is like they can drink tea or coffee or something like that after wearing the aligners. So it should not be too hot.
Okay.
Okay, if it is too hot, that might deform the aligner.
Material, yeah.
Yes, material.
Okay.
So those things. Braces, like no hard food items. Avoid the hard food items.
We have covered the treatment plan and procedures that are done on a customized level. Let's move on to the technology part. How does digital scanning change the treatment plan, or how does it impact?
So based on this new era, new technological era, like scanning, like will enter the next level. Okay, the thing is like by scanning we can preform the treatment outcome.
Right.
Okay, so that like it was like before treatment the teeth it is like this. After the treatment it will be like this. So we can show the patient. Okay, so like after the treatment of aligning, after the alignment, the tooth movement will happen this in these stages. So that after the alignment, after the teeth treatment, the tooth alignment, after the tooth alignment, the teeth positions will be changed. So those things we can show to the patient, so they can see like after the treatment how their teeth will be. So it's also kind of encouraging the patient, so that like if they do go for treatment, orthodontic treatment, so what will be the tooth position after the treatment. So it is in a better way or not. So based on that.
So it's like you're giving a snapshot before the
Exactly.
treatment, how
Exactly.
it is going to look after the entire
Exactly.
treatment.
And even we can right now we can show them how your face will look after the treatment.
Absolutely.
So those things, those advancements like technology, because of that, like lot of patients are going for the treatment.
Right. Since we are talking about customized plan and long-term treatment plan, so you need to take care of all your medical records, your lab reports, or your medical data. On One Health Assist platform, we have a very good feature known as a health repository, One Health Locker, where you can post all your medical data in a digital format, and it's accessible to patient and doctor both. So please use this particular feature and make the most of it. Since we are covering the digital technology and digital scanning, does this impact the accuracy of the treatment that you want to design?
Obviously, it improves the accuracy. The thing is like the precision of the treatment outcome is like almost like we are getting it.
Okay.
Okay, up to 90% of the treatment outcome can be determined before the treatment itself, because of the advantage of scanners and digital these things.
So to come out of the fear of having an orthodontics treatment, you can use the latest technology and digital scans. You can book consultation with Dr. Balajee on One Health Assist platform in online or offline format. Let's talk about the retention. Why do teeth naturally try to come back to its normal position after the treatment?
The thing is like the tooth is not directly connected to the bone. There are some fibers which is like connecting the tooth to the bone. Okay, so when we are moving the tooth to another position, so the fibers will get extended like rubber bands.
Correct.
So if you stretch a rubber band and leave it, it will try to go back to its old position. Same thing happens in the tooth. So that's why we are giving retainers. So once if you stretch the rubber for a longer period, the elasticity of the rubber band will go off.
Right.
Same thing like that. Okay, the thing is like once the fiber stretches, okay, that once like if you're not wearing the retainers, the teeth will because of the stretch, the teeth will try to go back to its old position.
Okay.
Okay, so if you're holding the tooth using the retainer for quite a little bit longer period, so that doesn't happen.
Okay.
So that's why the retainers plays a major role after the treatment to hold the position. Like retainer is nothing but like to retain the tooth in the same position what we have attained.
Okay.
That's called retainers.
Thank you, sir, for putting it in simple terms for our viewers why the retainers are so important.
Thank you so much.
How long the retainers have to be worn?
The thing is like there are different theories behind it. Okay, so based on that, like for every patient has to wear the retainers for 6 months for sure.
Okay.
Full time. Only while eating they have to remove it, and they have to wear it back after their meal.
Okay.
Okay. What I used to prefer is like 6 months, 24/7 you have to wear it.
Mm-hmm.
For the next 6 months, only in the night.
Only in the night. Okay.
Yes. So that we can know that whether the tooth movement is happening even after 6 months. Okay, because morning they don't wear it. So if there is gap is opening up or not, any tooth movement is happening, we can just come to a so that we can put them in a track. Okay, so it won't get worse.
Okay.
Okay, when they're coming to us again.
Okay.
That's what.
Let's try to find out what happens when the patient try to ignore the retention or the device.
The thing is like if they are not wearing the retainers in what will happen generally, like the teeth tends to come back to its old position, not completely, a little bit. So there might be like if the planning, like if you are removing the tooth and doing the treatment for a patient, the space closure will get opened up and there will be a gap between the tooth. Those things happen, and there might be a chances of like tooth weakened also. Okay, because of the tooth movement, to and fro movement of the tooth, that might weaken the tooth also. So again, we cannot. I mean, for few patients, we cannot go for the treatment again. Okay, so for like to push the teeth back again. Okay. So those problems are coming up. So we used to suggest that go for wear the retainers regularly. Okay, for at least for 6 months, so that you no need to come back again to us facing the same problem.
Is also very important. So to emphasize here, based on the orthodontics treatment, even the follow-up plays a very, very important role. So you can set reminder for your follow-up visit and even the consultation on One Health Assist platform. When we're talking about the orthodontics treatment and the duration, does that actually get over the period of time there are any complications?
No, the thing is like maximum duration. What we used to say it is like it starts from 1.5 years to 2.5 to 3 years for at the max. Okay, not more than that mostly. Okay, for few patients who are like irregular, who they don't cooperate with us, the treatment duration prolongs. Okay, and one more thing is like whatever the tooth movement we achieve, it will stay for longer time. So they won't face any other issues because of this. If there is something goes wrong, if there is like too much of pressure applied or something like that, there might be a problem with the tooth, like a kind of the root get resolved or something like that. Those issues will come up only if we are applying too much of pressure on the tooth. So generally, if we don't do that, okay, so in that scenario, there won't be any major problems come up with later on stages.
Since we are talking about the orthodontics treatments, how should patient differentiate between the cost part versus the lifelong benefits of the treatment?
As I told you, like teeth alignment is more important, functionally, especially like for chewing the food and masticating it. So only if you chew the food properly, all those minerals will get absorbed inside the body.
Correct.
So tooth plays a major role in that. So thinking about the cost and like why do you want to spend so much for the tooth? Okay, so this is what the thing is like is going on with the people's mind.
Right.
So in that case, what will happen now? They are not knowing that what is the importance of the tooth. Okay, only if we chew properly the food, whatever we chew properly, that the minerals and vitamins, those things inside the tooth, inside the food, that will get absorbed.
Correct.
Otherwise, it doesn't happen. So that's why most of the people goes to the hospital and spending money for their health issues.
Right.
Okay, so they could have done it by aligning the tooth itself.
Rather than going back to the
exactly
basics.
Anyway, they are going to spend after that.
Exactly.
Okay, going to the hospital and spending so much. So they can correct their tooth alignment and they can chew properly. That's what.
So when you have hesitation about the dental treatment, think about the part doctor just mentioned. Rather than going for a longer treatment later on, start your dental treatment at the first sign only. Fine. We've covered all the aspects of dental care and orthodontics treatment with Dr. Balajee. Now, sir, what I want to know is how does a platform like One Health Assist help you in covering up all your
generally, like One Health Assessment, like we are using it for the patient's appointments, those things.
Correct.
And like we are maintaining patient records in it. So we are not skipping anything.
Correct.
And according to that, like we are like uh, appointment wise. Okay, so we are just mentioning the appointment. So patient is getting a message
Right.
regarding their appointments on time. Prior, like to the appointment, they are getting one, and before the appointment, like itself, like just few hours before the appointment, they are getting a message too.
Right.
So those ways, like it is like really helpful. And one more thing is like prescription, like we can save the prescriptions, so we can just message them, like we can send the prescription through
Yeah.
message also,
Yeah.
or through mail.
Yeah.
So those things like little helpful for us.
Okay.
So like we are not like asking the patients to come down to clinic to get the prescription.
Correct.
So wherever they are, like we are sending the prescription to message through message, so they're getting it. So it is very useful for us. And like a lot of features I have to reveal more. Okay, I have to know more about it.
Right.
So I'm using it. So I'll try to, like, even I can give them some suggestions
Okay.
regarding this. I'll let you know.
Thank you so much, Dr. Balajee, for all your details and insights on orthodontic treatments and your experience that you shared with us on this particular topic. It was great talking to you and having you on this podcast, sir.
Thank you so much, ma'am. Thank you.
This brings us to the end of the podcast. Thank you, doctor, for giving
Sharing.
us insights on the orthodontic treatment part and sharing all your experiences in detail on this particular topic. It was really nice to have you on this podcast and discuss all the aspects. And thank you so much, sir.
Thank you so much. Thank you, everyone.
If someone is confused between braces, aligner, or what orthodontic treatment to take, you can view or listen to this podcast. This brings us to the end of this podcast. I am your host, Deena, signing off for now from this podcast. Please like, share, and subscribe, and stay tuned.